Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of this show, I'm going to continue to talk about cirrhosis of the liver, which I started last week. The liver is this organ you're looking at right here on the poster. It is an integral part of the human anatomy. No one can survive without the liver, as is the case with most of the organs. But the liver is the biggest factory that we have in the human body that produces a lot of things that we need to remain healthy. Also, the liver is the big detoxifier. Everything that we inhale that gets into our bloodstream, everything we drink, everything we eat, everything that is injected into us or in some form or another, ultimately find its way in the liver, and the liver has to process it, get rid of it, break it down, or whatever. Now, there are many people in the world who suffer from cirrhosis of the liver. In this country, there are 5.5 million individuals at any one time who have cirrhosis of the liver. And worldwide, there are 500,000 folks who have cirrhosis of the liver. In this country, 25,000 folks die every year because of cirrhosis of the liver. As I mentioned in the previous show, the most common there are many causes of cirrhosis of the liver, the most common being alcohol abuse. And the second most common will be, believe it or not, obesity. And I'll explain to you why. And the third will be different forms of hepatitis, from hepatitis B, C, D, E. Hepatitis A does not cause cirrhosis of the liver. It can cause the liver to fail acutely, but once the liver recovers from the effect of acute hepatitis A, that's the end of it. It does not cause any permanent damage to the liver. Now, alcohol causes damage to the liver because alcohol is very toxic when consumed in large quantity. And the liver has to break the alcohol down in its component part, but the alcohol itself damages the tissues of the liver as a toxic material, And then once that happens, then an inflammation develops. And once the inflammation develops, and over time, in particular, folks who are chronic alcoholics, they continue drinking, and they keep putting alcohol in the system, and the liver cannot handle it because it's just too much, and they're constantly having the recurrent inflammatory process going on inside the liver. And as the acute inflammation begin to go down, then you have chronic inflammation steps in, which then lead to scarring of the liver. And the scarring of the liver is what cirrhosis of the liver is. When that happens, the tiniest little vessel inside the liver get damaged as well, causing obstruction of these little vessels, resulting in a series of serious medical problems, which I will be eventually discussing with you. That's how alcohol does it. Now, I mentioned obesity, as you well know, is an epidemic in this country. The report came out last week that 38% of American adults are obese, 38%. And when you combine that with people who are overweight, altogether, it's 2/3 of the adult populations in this country obese. And the last I read, it was somewhere around 13 to 15% children and adolescents are also obese. It is an epidemic. It is an epidemic. Of all the developed countries of the world, the U.S. is number one in terms of obesity. So you say, well, how do you go about obesity and cirrhosis of the liver? Well, obesity is a result of fat that one builds up in the tissues in the body. Inevitably, the fat has to go to the liver. It is the liver's job to try to process this fat and then try to distribute it to the soft tissues as much as it can. And then the fat gets deposited in the soft tissues and obesity sets in. Now, when the fat sits inside the liver, the fat itself sits inside the liver, it causes a condition called fatty liver, because everybody, doesn't matter who it is, rich, poor, whatever, who are obese, have liver disease to one degree or another. And if the obesity persists, which it is in most cases, then of course the fat begin to accumulate even more in the liver and begin to break down. As the fat infiltrate the tissues in the liver, then it causes damage to occur. And then the damage ultimately can lead to cirrhosis of the liver. And that is why I mentioned is at number two, because you have that many folks who are obese throughout the world, and of course in this country more so than other developed countries. And you say, well, why so many people are obese in this country? Well, first of all, it's a cultural thing. People eat in this country to fit, fill themselves with food, as opposed to other countries such as France, for instance, where people eat to enjoy the food, to sit on the table with a friend and spend 2 or 3 hours talking, shooting up the breeze, and enjoying a glass of wine, and then eat food not to fill oneself. Uh, uh, that's one thing. Another thing, the quality of the food in this country, which is a very rich country, you have the two extremes. A group of people who are very, very poor, in the midst of this wealth, you have folks, children and adults going to bed every night without anything to eat. As cruel as it sounds, but it's true. You got a lot of hungry people in this country of incredible wealth, because the cultural system here is that the rich get richer and the poor get poorer. And to break oneself out of poverty in America, it's very difficult. It is possible, definitely. Look at me. I mean, I was one of the poorest person that the world could ever have. I struggle working in the factory in this country, $1 per hour, when 8 hours a day, when I realized that that was going to get me nowhere. And so I took the even more brutalized hours, which was 6 p.m. to 7 a.m., which was a 12-hour shift. That then enabled me to go to school 11 a.m. to 5 p.m. To take laboratory technician course so that I can get myself out of this terrible situation that I was in. So it was it's a matter of life or death. Either I survive or I die. And so I decided to went for it, because I know that all I had going for me besides my personal behavior was God has given me this incredible level of intelligence, and I knew it. I knew I had it from the time I was a little boy, and so I used that to get me away from this disastrous situation, and that's the only way. That's the only way that I know. Of course, other folks who have no other way, that's their business. To me, is the hard way. Go to school, study hard, get good grade, graduate, get a profession, and earn a living. And that's the formula. So, and that's what I came to this country for, and that's precisely what I did. And unfortunately, you have folks here, once they find themselves in this cycle of poverty, the system is organized in such a way that so many things are against them. So many things are against them. It is very difficult to break through. When I came to this country in the early 1960s, there were more opportunities, however, for people such as myself, a black man, to get ahead. Now, all these opportunities have been eliminated. Eliminated. The system somehow found out there were little cracks that black folks and other minority folks can get through. All those were sealed. They're finished, finito. It's very difficult. It's possible, but extremely difficult now. It's not as easy. All the channels that were open have been shut, closed. So now, what do we do? Well, that's why we have all these folks who are poor. I mean, rich folks get fat as well, but more poor folks are obese than rich folks. That's why you have more obese black folks than you have, and more obese Latino folks than you have white folks. So because the system forces them to eat a diet that is rich in fat, rich in simple carbohydrate, and then they feed on those things. They feast on them because that's what they have access to, and they cook it in a way so that it's more palatable, make it tastier. And then it's okay to eat this food once in a while. You go to a restaurant where these things are sold, you eat it once in a while. But when you're eating it day in and day out, it becomes it becomes a problem. And then you have all this fast food. The poorer the community, the more fast food restaurants you have. And then people are feasting on hamburgers, feasting on hot dogs, feasting on cheeseburgers, and feasting on pizza, feasting on all this quick stuff that they can get their hands on because that's all they have, all the bagels and all this other stuff. That's all they have access to. That's all they can afford. And this is not a criticism. That's the reality. I mean, when I was working in the factory, I eat American cheese. I have about a pack of it, and I order a loaf of Wonder Bread and a cup of Kool-Aid. That was my meal for the day because I had $1 to live on for the day. 45 cents of that was for three tokens. I needed one to go to work, one to go to school, one to get home. So I basically had 55 cents to live on for food. That was it. And I had nothing else. And I had no saving. I was living in a little kitchenette paying $10 a week. That was it. And then somehow, through the help of God, and I managed to get out of it. That situation is worse today than it was for me in the early 60s. Believe me, it is several times worse now than it was then. Several times. So now you can't, what can you say? I mean, as a physician, I see obese people in my office. I do the best I can to advise them, to explain to them what obesity is, why they are obese. I evaluate them. I do make sure that the thyroid is functioning, the thyroids are functioning well, etc., etc. But I can talk all I want. As soon as they get home, what kind of food they have access to? Junk food. And food that are, if it's not junk food they buy, the food they cook, the way they prepare it is incredibly unhealthy. So they get obese. And then the obesity is associated with liver disease, which is what I'm talking about now, and a whole host of other conditions which also can damage the liver. They become diabetic. Well, diabetes can, in many ways, have issues with the liver as well. So that's the story. So that's obesity. The next problem, of course, is hepatitis. Hepatitis B, hepatitis C, hepatitis D, hepatitis E. Those are the four types that cause inflammation to develop in the liver because the virus get into the bloodstream and the virus goes to the liver. That's where the virus live. That's right, in the liver. Those viruses live in the liver. That's where they are. They load up the liver. They multiplies in the liver. They cause a local inflammation in the liver to develop. And then folks then went on to develop a whole host of other problems. Okay, some of the viruses got there because people use intravenous drug with contaminated needle, and they get sick. They get sick from it, and then of course some unfortunate people get it from the blood transfusion, even though the blood is now extremely much safer than it used to be, but nothing is 100%. And people get accidental punctures, healthcare workers, etc., because of things happen, accident happen, and they acquire hepatitis. People acquire hepatitis C sexually. They can acquire hepatitis B sexually, as well. And so those are the ways in which they acquire hepatitis. And once you get it, it is very difficult to deal with. Now we have certain medications that are out there to treat hepatitis C in particular, but it costs hundreds of thousands of dollars. And who can afford it? Few people can. Then you have to fight with the insurance companies to get to them to pay for it, which is a very difficult task. Okay, so there you go. In addition to that, of course, you have primary biliary cirrhosis, as I mentioned last week, hemochromatosis. Well, hemochromatosis is a very common problem. Hemochromatosis is iron, primary or secondary. The primary hemochromatosis are hereditary issues, genetic issues. Secondary hemochromatosis, most of the time, is due to other conditions that cause one to develop a lot of iron. For instance, if you have the very same hepatitis that you have, which is really horrible, the hepatitis causes the inflammation. The inflammation becomes chronic. It damages the tissue of the liver. Okay, fine. As this process is going on, because of the inflammatory process, the iron piles up in the body. That's right. The iron piles up in the body because the transferrin protein is being affected in a way so that it cannot pick up the iron from the bloodstream to carry it to the bone marrow to incorporate it into early erythroblasts. Cannot do it. So therefore the iron backs up. But that iron that's backing up is also damaging the kidney secondarily as well. It's being affected primarily because of the infection, the inflammation. Now that the inflammation causes the iron to pile up, we develop secondary hemochromatosis. That piled up in the liver as well. And that itself damages the liver because the iron, as it sits in the liver, be it primary hemochromatosis, be it secondary hemochromatosis, it's going to degrade. As iron degrades anywhere it is in the body, it's going to release free radicals. Well, free radicals are extremely toxic. They damage tissue. So that's going to damage the liver as well. So now you have an idea, and you have hundreds of millions of people with hemochromatosis across the country, across the world, be it due to thalassemia, alpha thalassemia, beta thalassemia, a whole host of other thalassemias, hemoglobin C that causes hemolysis. All these things come as hemolysis. Well, once the red cell hemolyze, it means they're bursting. They're releasing the contents. Part of that contents, of course, is iron. It gets deposited there, okay? So that's secondary hemochromatosis. And then we take it for granted in this country, but hemochromatosis is very common throughout the world because all these conditions that I'm mentioning to you are very, very highly common throughout the world. Asia, Africa, the Caribbean, Latin America, all these things, Europe, all over the place. You have all these folks who have all these different diseases, and they're dumping iron into the system. And they are the difficulty is that they are so anemic, you're not able to phlebotomize them, meaning drawing blood from them to remove the iron because they're too anemic to begin with. Also, you could chelate the iron in some instances. Yes, we have that expensive medication we could use to chelate the iron so that they can urinate it. Yes, we do some of that effectively. Okay, but you have to understand all these people, everybody who has sickle cell anemia, you can't have sickle cell anemia or sickle cell disease of different types without having secondary hemochromatosis. The iron has to go somewhere. Where is it going to go? It piles up in the body, and it finds itself around the heart, finds itself in the liver, finds itself around the joints, causing all these other devastation. Okay, so that's that. Now we have what else? Primary sclerosing cholangitis, biliary atresia, cystic fibrosis, Wilson disease, lupus, erythematosus, rheumatoid arthritis, all the mixed collagen vascular diseases, because they are inflammatory diseases. All inflammatory diseases of one kind or another leads to secondary hemochromatosis, which then wind up piling up into the liver. Glycogen storage disease, parasitic infestation of one type or another. There are hundreds of millions of people across the world who are affected with parasite of one kind or another. They find themselves in the liver causing all sorts of problems. Now, I'm going to begin to talk a little bit about some of the signs and symptoms of cirrhosis of the liver. Okay? That brings me to tell you, the list is so long, it's more than a page long. So I'll read most of it to you to give you a taste. Fatigue, poor appetite, weight loss, easy bleeding, easy bruising, nosebleed, low platelet count, high prothrombin time, high partial thromboplastin time, upper GI bleed, bleeding in the gums, okay, nausea, vomiting, abdominal pain, jaundice, enlarged liver, enlarged spleen, itching, spider angiomata. What are spiders? Spiders are things that develop over the skin, little spider like that grow over the skin, and we call them spider angiomata. All right. Then you have itching. You have enlarged spleen. Okay. Then you go ahead and you wind up with people having women having intermittent intramenstrual period breakthrough bleeding. So, well, how do you go from having cirrhosis of the liver and having bleeding between your period, causing you to have the iron deficiency anemia? But here's the deal. The excess estrogen that the liver ordinarily handles breaks down and gets rid of it. The liver is too sick to do it. So that excess estrogen and other hormone piles up in the bloodstream, overstimulating the GYN organ, resulting in bleeding. That's how that happened. Okay, that's how that happened. So those are, and you have shiny skin, very shiny skin, because the excess hormone that are in the blood causes the skin to be very thin. That's how you develop the spider angiomata, very, very thin. Okay, you could see them, little spider type over the skin. Okay, and you touch it, it starts bruising. Okay, the men wind up with large breasts, because you have to understand something. All men have estrogen in their bloodstream. Let me repeat that. All men have estrogen in bloodstream, and all women have a certain percentage of testosterone in their bloodstream as well. Well, the liver is too sick to handle that. So usually the liver breaks it down, you urinate it out, that's the end of it. But now the liver is too sick to do that. So the excess estrogen that the man has in his bloodstream causes they have large breasts and painful nipples. Okay? Shiny testicle, shortened private organs, etc. Because these are female hormones. They have no business being that high in the man. Well, because they're high, now they are working against the testosterone that the man ordinarily has plenty of. So therefore, they're men. You don't have the right to have all this female hormone in your bloodstream, but now you do, because the liver cannot break it down. Okay, so as far as the bloodstream, the liver is concerned, there's nothing it can do about it. So therefore, you have all this problem. And as I said, the edema of the legs, fluid in the abdomen, anemia, low white blood cell count, low vitamin B12, dark urine, you pack clay-looking stool, whitish-looking stool, okay? I mean, it is devastating to have this disease, and it creates a whole host of serious problems for the persons, be it men or women, who are suffering from it. And unfortunately, this individual, if it is alcohol that's causing it, they wind up using alcohol continuously, and they get sicker and sicker. You have to understand, there are medications as well that can cause cirrhosis of the liver, that can cause the liver to fail. One I will mention, which is a medication that I prescribe several times per week, cautiously, which is Tylenol. If somebody take an overdose of Tylenol, which some folks have been known to do, the liver might fail. So if you're going to give somebody Tylenol, you make sure that you know the underlying liver conditions, because the liver cannot break it down. All these medication that we prescribe for folks, all of it, every single one of them, has to be broken down by the liver. They have to go to the liver to be processed. Okay? They have to go to the liver to be processed so that they can be of value to the individual. So therefore, some of these things are very toxic. Tylenol is a great medication. I take it myself and I prescribe it. But you got to be very careful. Sometimes if you know the patient's liver is so bad, you back away from it. Find something else to give the patient. The quandary is the fact that somebody has a fever and they have cirrhosis of the liver. The liver is very bad. What do? Well, can't give them aspirin. Why? Because they have low platelet. They have abnormal coagulation tests. So you can't really do that. The aspirin will make them even bleed more. So what do? Well, you can't give them Tylenol either because the liver is too sick to be able to break down the Tylenol. So what do? Well, what you do is that you practice clinical medicine. You put your clinical hat on. You find ways, which I'm not going to get into because that's not the purpose, to bring the fever down, which we do. I'm not going to get into that. But I just want to warn you, those are difficult decisions, difficult processes that you have to deal with. Somebody have very high fever, which people do, because you have to understand, cirrhosis of the liver predisposes individual to bad infection as well, because the liver has a filtering mechanism that helps to get rid of bacteria when somebody is carrying it in the bloodstream. Well, the liver is too sick to do that. So that individual now becomes severely immunosuppressed by virtue of having very bad liver. And you can't have bad liver and have a healthy spleen, which you also need to help you to kill the bacteria, because the spleen secretes certain substances that are needed to dissolve capsules that certain bacteria have covered with. Well, the spleen is sick. There's no way you could have cirrhosis of the liver and don't have portal hypertension. So once you have portal hypertension, then you're going to have problem with your spleen. The spleen becomes enlarged. It's pretty much not functioning properly. Listen, I'm going to stop here. Next week, I'll continue to talk about cirrhosis of the liver. Until such time, keep watching the show. This is Dr. Alcena saying so long and bye-bye.